So today's topic is going to be on white coats. Do we need them? Should we throw them away? Let's talk about it. So an interesting article caught my eye the other day about a survey done in JAMA recently, which took a look at how people perceive doctors in their white coats. The survey was pretty interesting. It looked at a few different variables, and the broad conclusion was that patients perceive doctors with white coats to appear as having more experience and overall have a generally positive view of doctors wearing white coats. The article was interesting to me because I've noted all the way since medical school really that most of my colleagues these days don't actually prefer to wear white coats. If you go into a hospital these days, you'll notice that the majority of resident physicians actually prefer to wear blue or black scrub jackets. Shout out to the scrub companies, by the way. Those are really cool and they're very comfortable. But it's interesting to me that the preference for what to wear is so different between actual doctors and patients. So I decided to do my own little survey, an informal survey on Instagram. I put up a post and asked all you guys, what do you think about doctors in white coats? And the response was pretty huge. Over 60 responses in the comment section on the post, and over I think 20 to 30 responses in the story posts on Instagram. And overall, there was a very, very broad consensus. I think almost 100% of you guys really like and appreciate doctors wearing white coats. I mean, I'll share some of these comments here. And just this is what you guys thought. I mean, you guys had really awesome things to say, and it was pretty clear what you guys' preference was. So, you know, that to me was pretty interesting. The white coat itself is a symbol, and what that symbol means really is in the eye of the beholder. It's related to the history of the white coat, but also to the perception of doctors in hospitals. And that means that so many things play into what it's seen as. So I thought it'd be interesting to talk a little bit about the history of the white coat in medicine. So let's check it out. There may be nothing more symbolic in the field of medicine than the white doctor lab coat. But have you ever stopped to ask yourself a question, why do doctors wear them? It's a good question. It may surprise you to learn that historically, up until about the late 19th century, doctors didn't actually wear white at all. In fact, doctors at that time only wore black. The black garments of doctors of the past not only signified their sober, serious presence, but also served the pretty practical function of disguising dirty garments and all the messy stains of the profession. Over time, the medical profession advanced beyond things like bloodletting, and we discovered things like germs. And the American Medical Association decided to make a push to remake how doctors appeared to the public. So it was out with the black look of death and in with the clean, sterile look. Hospitals made the switch to equipping their beds with fresh, new white sheets. Nurses topped their hats with white caps, and doctors donned fancy new white coats, meant to restore the public's trust in them, and their new hand-washing skills, meant to reduce the presence of germs. Sure, the black coat may have been a little more practical in terms of hiding stains, but the white coat became an overarching symbol of the new face of medicine. The shift happened relatively quickly, as two famous paintings by Thomas Eakins famously depict. One, from 1875, called The Gross Clinic, shows doctors wearing all black, and a second, from 1889, called The Agnew Clinic, shows doctors wearing their brand new white coats. No one is 100% sure where the first white coat came into the picture or who exactly designed it, but it is clear that the white coat became a symbol portraying the doctor as a clean, safe source of authority in the new and improved medical field, and that image has never really left. Thus, the iconic doctor's white coat was born. Now, since that time, a lot has changed. The medical profession has continued to evolve, and white coats have as well. These days we've got white coats designed both for men and women. We've got white coats that are tailored for better fit, with better fabric. As iconic as the white coat is, the world of medicine has also continued to evolve in its perception of the coat. Over time, people have questioned whether it's become a hierarchical statement about a doctor's power over patients or even coworkers. And some in the medical industry are questioning if the white coat hurts or heals. In fact, these days we've got diagnoses like white coat syndrome or white coat hypertension that directly link the white coat and its perception to contributing to disease processes. However, with all this said, surveys still consistently show that many patients find comfort in the symbol of the white coat for medical professionals, and it remains a central figure in patient-centered care. Thankfully, today we've got a lot of choices. Doctors can go with the white coat and the traditional look, or they can go with the scrub jacket, or no jacket at all, and just dress clean, neat, and professional. In our modern world, medicine continues to evolve, but the white coat continues to live on. If you made it this far through the video, I just wanted to say thanks a lot. I appreciate your support here on the YouTube channel. I'm gonna have fun and continue to make these videos as long as you guys continue to enjoy them. And I'll see you again in the next one, alright? Peace.